Hi, I'm Dr. Jonathan Pontell, and we're going to talk about hair transplantation. We use a technique called SmartGraft hair transplantation. It is a technique where we're able to take individual hair follicles from and back. These are the hair follicles that never fall out. They're genetically programmed to just stay forever. So we're able to take those hair follicles and we're able to implant them in front or on top or in the crown, and we're able to give patients back the hairlines that they had before they had hair loss. Old-fashioned hair transplantation was a technique where the surgeon would remove a strip of scalp in back, and that strip of scalp would have to be cut up into individual tiny little grafts. That was incredibly time-consuming and tedious and labor-intensive. So now we have this device called SmartGraft that allows us to take individual hair follicles or tiny little groups of hair follicles and implant them, and the results are completely natural. If you've ever seen a hair transplantation patient from 20 years ago, they looked like they had plugs, big plugs that were very unnatural. Now we're taking individual hair follicles or tiny groups of follicles. The results are perfectly natural. Patients with moderate to severe hair loss are excellent candidates for SmartGraft hair transplantation. As long as there is good donor hair in back, which most patients have, we can borrow a portion of that hair to transplant and recreate a hairline that's natural, fill in temporal recessions that have occurred, and fill in the crown. So depending on how many grafts are done, the procedure can take anywhere from 3 to 8 hours. Patients are awake during the procedure and there is really minimal discomfort. We give patients a bit of Valium to relax them, but it is not a painful or difficult procedure to go through. For 2 days after the transplantation procedure, there's a dressing that's on. You take that dressing off at home, and at that point you can wear a hat and nobody would see the areas where the transplantation was done. You can get back to your normal activities 2 weeks after the procedure. So the results are excellent. The only issue is that patients have to be patient. The hair doesn't grow immediately. It takes about 3 months to really start to see the growth, and it takes a year to have full growth. Once the full growth has happened, patients feel so much better about themselves. They feel so much less self-conscious, and it really can be a life-changing procedure. Risks to this procedure are minimal. It's an incredibly simple procedure where there are very small openings made in the front or in the top of the scalp to allow the transplants to be placed, and in back there are little tiny openings where the hairs are taken, but the healing is incredibly quick. When I was a resident, I did lots of hair transplantation cases, and the results were good, but the procedure was incredibly tedious and labor-intensive, and I really didn't want to do it in practice. Once SmartGraft came out with their new device, it changed the procedure dramatically, where it was much less tedious, much less labor-intensive, and the results are even better. So I got back into it about 5 years ago, and we've been thrilled with the results, and more importantly, patients have been thrilled with the results. The other treatment that we do for hair loss is called PRP, platelet-rich plasma. These are injections that we do into the scalp from using the patient's own blood. We're able to spin the blood down, just get the platelet layer out, and the platelets have a high concentration of growth factors in them. And we're able to inject those growth factors into the scalp, and in patients who have areas of hair loss, we can get hair follicles that have been dormant to reinvigorate and to start producing healthy hairs. A good candidate for the platelet-rich plasma PRP injections is a younger person, someone who may not be a perfect candidate for hair transplantation, but we can do these injections and stimulate their hair follicles that are dormant to reinvigorate and to start producing healthy hairs. So if you're interested in hair transplantation, the best thing to do is to come in for a consultation. I'll show you lots of before and after photos, and we'll figure out if you're a good candidate for this procedure.